Hey, it's Wong here with CHC Secrets. I'm going to show you a little bit of wound care stuff today since we have this crazy case. All right, so we have a case here where the wound is infected, and you see, just wanted to show you real quick. This actually looks much better than what it has been looking like the last several weeks. When you see the wound, the borders of the wounds white like that, it means that the wound is macerated. It means it's too wet. And it's been like that because he's just had this huge amount of drainage, and we've been, actually this is the best, we've been packing the wound. So let's get a sterile Q-tip. I'm going to show you how deep it is. So usually you can measure, you want to measure how long the wound is, right? So you can use a Q-tip and measure the length of the wound, yes, right? So usually what I do is I mark from the tip all the way to the end, and then I use nail to hold it to how long it is, and then you can take usually a measuring device of the paper and just kind of measure it out and say, okay, it's, let's see, it's about 4 centimeters. We're going to show you how deep it goes on the deepest end. So go ahead and put your nail right there. Let's see, at the deepest end, it used to be, let's see, is it that deep still? Or is it right there?
It's right.
It's a little bit
toward the edge of my glove.
Okay.
It's less than it was before.
It's less because it was measuring along the borders to see if there is any tunneling, right? So with a deep wound like that, one of the things that we've been doing is packing it wet to dry. Otherwise, it just wasn't. You just can't keep. You got to keep the bed of the wound not too wet, not too perfect. And he had an infection that that they had to go in and do an IND and debride it, but then there was a lot of complications, and one of the complications is diabetic. So wounds always heal. Wounds heal from the bottom up and the sides in. So if it's really deep, you've got to keep the outside part of the wound open to promote the healing to come up. So if you've never seen a wound care incision or anything like that, then I hope that you found this useful.